Now, I would request our chairpersons to say a few lines about this session and conclude. Thank you.
Assalamu alaikum. We have just listened to two important artists talk about causes of AKI. First speaker, Dr. Omar Farooq Mian, talked on paraquat poisoning related acute kidney injury. You may not see this case since you are working in Dhaka, but I have also worked in Diraspur Medical College very recently, and I see same picture there. Incidence of paraquat poisoning and paraquat poisoning related AKI is very common in rural areas of Bangladesh, and I thanking him for managed this patient. Paraquat poisoning is rapidly eliminated through the kidney. By the time renal failure develops, there's very little paraquat in plasma. So measuring paraquat level is not really helpful. And dialysis also may not be helpful because if it's already eliminated through the kidney once renal failure develops. That's why he stressed repeatedly that dialysis should be given within 2 hours. Otherwise, it may not help. And he started dialysis, but you see the result. 4 out of 5 patients died. Actually, this is the fate. This is not fault of the dialysis, but it is multi-organ failure develops since dialysis really helps little. And our second speaker talked on cancer chemotherapy related AKI. Previously, acceptance of treatment was less. Many patients rejected cancer chemotherapy outright. But last couple of years, treatment improved. Many patients taking chemotherapy, survival improves. So you see AKI also increasing. And AKI and recurrent AKI in cancer patient also common. He also only talked about AKI, but since longevity is increased in cancer patient, we see many cases of recurrent AKI. And AKI, recurrent AKI, unresolved AKI eventually may lead to CKD. I was thanking both speakers for their good content and mainly ending their presentation within very tight frame. Thank you. Now I hand over to Professor Iris.
Thank you. I would like to thank the organizers, particularly Professor General Mahmoud Mustafi, to call me to come up as one of the chairpersons. Today we had two topics. The first one was Dr. Omar Farooq Mia. As my co-chair has already pointed out that we see poisoning of paraquat poisoning less in Dhaka city, but is more prevalent in periphery. And this paraquat is quite easily available, and you see the lethal dose is only a small amount of paraquat, only about 20 ml is lethal, and it causes main damage to the lungs and also to other parts like GI tract, then heart, and also the kidneys. And you see there's a very high mortality. And actually, a recommendation that he said that it should be it's an important public health problem that should be brought notice to our policymakers so that we can reduce this situation. And Dr. Abu Saleh, Professor from Dhaka Medical College, he presented a very nice, elaborate discussion on AKI in cancer patients. And we know that AKI is conventionally and conveniently classified as pre-renal, renal, and post-renal one. And you have to think that every site, like pre-renal, there may be pre-renal issue, there may be renal issue, there may be post-renal issue. And starting from the state of hydration, sepsis, low blood pressure that can affect the pre-renal part, and all the part of the kidney, starting from the blood vessels, glomerulus, tubules, interstitium, and every part can be affected by the in cancer patients. And of course, he pointed out that we should also take the help of our urology colleagues for better management, because many of the patients they develop obstructive neuropathy that can be managed easily, and it should be thought of early rather than late. And they was actually he traveled very nicely, and all the segments have been covered. So I congratulate both the speakers, and let me conclude the session. Thank you.
Thanks a lot for to all the participants and members and chairperson for making this session very beautiful and knowledgeable. Now I would like to request them to accept their crest. Thank you.
পরে কথা বলবো।